What are the differences between a thermal burn and a chemical burn? A burn is a tissue destruction caused by a thermal, electrical, chemical, or radiological agent. In the event of an accident, you need to quickly assess the extent of a burned area. There are several techniques, but Wallace's rules of 9 is easy to remember. It allocates multiples of 9% of the total body surface area to different zones. 9% for the head and neck, 9% for each arm, 18% for each leg, 18% for each side of the trunk, and 1% for the perineum. Depth is the second essential criterion for assessing the severity of a burn. The burn may be first, second, or third degree. Thermal burns are the most common type of burn, accounting around 90% of all burns. Most occur in domestic accidents. Chemical burns account for around 2% of all burns. They are mainly caused by accidents at work. A thermal burn is mainly physical in nature, involving the transfer of calories by radiation and conduction. A chemical burn involves molecular reactions. At the microscopic level, it results from a chemical reaction between an aggressive chemical and a biological constituent. The severity of a thermal burn depends on the nature of the burning agent, its temperature, and the contact time. The mechanism by which chemical burns develop depends on a number of factors, such as the nature of the chemical, its concentration, its temperature, the pressure of the splash, and the contact time of the chemical with the biological tissue. In the case of a thermal burn, when excessive heat hits the skin, it forms a local response with 3 zones. The coagulation zone is the central contact point for maximum damage, resulting in the cell destruction and the protein denaturation. Impaired circulation in the vicinity of the coagulation zone leads to a second peripheral zone of stasis. The third zone is defined by abnormal accumulation of blood in response to injury. In the case of a severe burn, the release of inflammatory mediators and systemic cytokines causes an increase in capillary permeability and large-scale extravasation of fluid and proteins from the intravascular space into the extravascular space. This can lead to potentially fatal hypotential, pulmonary edema, and reduced circulation to the end organs. In the case of a chemical burn on contact, the chemical penetrates the tissue until it reaches a biological component with which it can react. Depending on its nature, it will react with a different compound in the tissue, destroying proteins and lipids. The chemical burn will occur from the moment the chemical reaches the biological target, which means 1 minute after initial contact. There are as many reactions that can form chemical lesion as there are aggressor chemical-biological target pairs. As a result, the biological balance is altered. The tissue is locally destroyed and a chemical lesion is formed. The lesion progresses as long as the chemical remains in contact with the tissue has not yet reacted. In the case of a chemical lesion, each reaction will have different microscopic consequences on the cells, resulting in microscopic lesions of different characteristics. For example, an acid will react with proteins and cause coagulation, while a base will dissolve cells by saponification of the fats in the cytoplasmic membranes and cause tissue necrosis and liquefaction. As well as causing injury, some chemicals have systemic toxicity: metabolic, renal, hepatic, neurological, hematological, etc. As we have just described, the injury process and the disruption to the body's functioning are distinct in a thermal burn and a chemical burn. This is why the aggressive agent causing the burn must be clearly identified when treating the patient, so that appropriate care can be given to the victim. During first aid, the victim must be moved out of the danger zone to interrupt contact with a thermal or chemical aggressor. If the victim is exposed to both at the same time, the chemical burn should be treated as a priority in order to limit the severity of the consequences. In the case of a thermal burn, clothing should not be removed if the fabric is adherent to the skin. The burn should then be cooled with water at 15-20 degrees for 15 minutes to reduce the inflammatory response and limit the spread of the burn deep down. Also cover the burn with sterile drapes to limit bacterial contamination. Finally, monitor the victim and seek medical advice. In the case of chemical burns, washing with water only allows the surface of the tissue to be washed mechanically. This has no effect on the product, which has already penetrated the skin tissue. In addition, washing certain products, such as lime, with water creates exothermic reaction causing a thermal burn in addition to the chemical burn. This is why washing with an active multi-purpose decontamination solution should be preferred. This solution not only washes the chemical from the surface, but also stops its aggression inside the tissue if it has not yet reacted with them. Use diphentrine solution for irritating or corrosive chemical splashes. Use hexafluorine solution for hydrofluoric acid. For diphentrine solution, apply the following intervention protocol. Start washing as soon as possible, within 1 minute following the splash, starting with the uncovered areas. Then undress the victim, remove any eye lenses, and continue washing the undressed areas. Make sure you use the whole pack. Finally, do not put on clothes that have been soiled by washing or chemical products and consult a specialist as soon as possible. In the event of eye contact, there are two solutions, depending on the speed of the operation. In the case of skin contact, there are 3 types of solution depending on the surface area of the affected area. If you start washing after 1 minute, extend the wash time by affected surface according to the diphentrine solution protocol. Then seek medical advice as a matter of urgency. In the event of a serious burn, the victim's life may be at risk. Pre-hospital and hospital treatment will enable initial assessment to be made and the victim to be given first aid and appropriate secondary treatment. This video was created in collaboration with the Spanish Association of Occupational Medicine Specialists. Thanks to them.